There are multiple reasons why the people from LGBTQ plus community experience high prevalence of mental health difficulties. Um, I'm going to mention a few of those here, but there are many other factors which we can actually unpack within the time if we get to. One of the key things actually comes from how society has perceived LGBTQ plus community. What now researchers are able to describe in a much more succinct way called marginalization theory. So anybody who is actually discriminated for who they are not completely seen and heard and valued in the society. And in worst case scenarios, bullied as well as tortured. So the impact of those early life experiences and the trauma they experienced before and continue to experience affects their well-being, self-esteem, affects their confidence, affects their ability to engage with people in a kind of a much more meaning, supportive, understanding, and caring way. So what it does is it actually have an external impact, as some of those I mentioned, but it also has an internal impact that how they perceive themselves in the world around them. And these factors affect how they, as they grow up, how they actually take risks, how they become vulnerable, how they engage in communication, as I mentioned before. And all these combination can be explained through the marginalization theory. There are other kind of factors. We know discrimination, which continues throughout their lives. The research continue to tell us they are discriminated in employment, in the social kind of inclusion. They are discriminated within the kind of the surroundings they live in. So a huge external impact, which then affect their internal well-being as well. So these are some of the factors, elders, but we can go and discuss this in much more details as we will continue to through the different podcasts and things we will produce. For some of the things I mentioned before, what psychiatrists and psychology and I being a psychiatrist, I need to own this actually, that we are not always looking for a diagnosed or diagnosable mental illness when we are working with person from LGBT community. What we need to look at is the holistic picture of the person who's living in. Some of the things I mentioned before, the impact of their identity, how that has shaped their well-being, but also their circumstances they are living in. So diagnosis is actually can help, and it does help in certain circumstances because it gives them a recognition and a voice so they can fight against the system who probably is not listening or hearing them. But the most important thing for any psychiatrist or psychologist is to look beyond it and see how we can really help people as well. So I think that having said this, if we look at actually the mental health prevalence, there's a high rates of depression, high rates of anxieties, very high, significantly high rates of self-harm, significantly high rates of substance misuse. And we know now there are more evidence emerging that there is some link between ASD and the transgender community. We are identifying that there are high prevalence of many other mood disorders as well. So these are some of the kind of mental health difficulties, but there are other psychological difficulties, which I'm just going to touch a little bit on. One big factor is called shame. So, and very briefly, when somebody is not heard or understood growing up, then that actually becomes internalized and manifests as I am not good enough. And this feeling make them try to compensate for the shame by putting so much extra efforts to continue to fight against this feeling I'm not good enough. And that actually also affects their well-being. So I have mentioned some of the mental health diagnosis, but plus psychological kind of factors which can affect their mental health and well-being. Signs are very similar to most of the mental health difficulties practitioners experience when they are dealing with any other person as well. So for depression appears the low mood, lack of motivation, lack of energy, withdrawal from social engagement and activities, becoming more and more hopeless, sometimes worthless, and people may start to have self-harm or suicidal ideations based on the nature and severity of depression. Um, when people are feeling anxious, the general feeling is overwhelm, rumination, feeling thoughts are out of control, unable to control the kind of thinking. Panic attacks could be part of it. Um, when we think about the traumas, which many of the LGBT community have experienced for various reasons, then the signs could be um, any kind of smallest activator or a trigger can take them to a place of either shock or complete numbness or complete withdrawal, which means that they are less likely to engage with the surroundings and the world around them. When we look at the other kind of substance misuse difficulties, you would notice that if you are experiencing that you're trying to compensate for the feeling of loneliness and numbness and low self-esteem by trying to introduce some sort of stimulants. So some people, and stimulants could be as simple as having more coffee or caffeine, to it could be using more stimulant drugs like cocaine or amphetamine or ecstasy to overcompensate with. So there are multiple ways they can manifest. And one another thing is actually, which is not often talked about, is the impact on social relationships. So often people may end up in unhealthy, unhelpful relationships because of either so low self-esteem or because of not being able to, or previous traumas, which is making them vulnerable for unhelpful relationships as well. One thing is, we all know the most person we know in our life is us. I mean, I was actually reading a book recently, and one of the thing the book mentioned about the most I would ever talk to is myself. So be kind to myself. Um, and what it is actually, why I'm saying this, because before anybody knows it, I would know what's happening for me. So listen to that changes when you are noticing your mental health is actually shifting. Your regular or normal stabilized pattern is changing. And it could be from withdrawing from social engagement. Um, Work actually has changed, friendships have changed, or you are becoming more isolated. And some of the things I mentioned earlier about some of the symptoms, if they start to emerge, such as hopelessness, worthlessness for depression, intense rumination for anxiety, or numbness, or increased attempts of use of stimulants, people should try to reach out and ask for advice. When it starts to affect their functioning to the level that they start to detach from the functioning, work, and social relationships to the extent that other people start to worry about as well, then definitely reach out and seek advice. Very, very important. Um, so one of the thing about this, I'm just going to briefly mention about the stigma which affects us. So I talked about some of the stigma of mental health difficulties, how it affects someone, because it creates shame, because the society is still catching up with accepting mental health difficulties when we compare with physical health difficulties. So if somebody had a cancer or significant illness, physical health illness, they will get lots of social support and family support. But mental health difficulties are different. I talked about internal factors, but there is a stigma in external society as well, which makes it difficult for people to know how to help other person. So I'm going to share a few things about how you reach out. The first important thing is compassion. Be compassionate. Give space to your loved one. Offer them opportunities to talk to. Finding the right balance, what works between you and your loved one, because you know your loved one more than many professionals might do. So ask what works for you, But the most important thing is a consistent, compassionate support. You being available for them, telling them that you will be there whenever they want to speak to you, and navigate this with them, the person who is having the difficulties. And it could be sometimes very clear communication, like I mentioned, or it could be just spending time with them, inviting them to become socialized or go out with you for coffee, for drink, or cook them a meal, spend some evening watching a movie with them. These are some small kind of things you could do. But if you do start to notice the signs are becoming significant, then do consider asking them to seek professional support as well. Because, and if you can join, if they are willing to, then join the meeting as well, because you will be helping the professional to draw up a clear plan, so where you are part of this plan, if your loved one who would like you to become involved as well.